Okay, hello everyone. Thank you so much for joining us as we wrap up. As you know, we've had a number of great sessions, so thank you all for joining us. We just want to give a few takeaways from our local partner panels today, and a few housekeeping issues before we wrap. So my name is Jason Porter. I'm a local partner strategy advisor in the Office of HIV/AIDS here in USAID Washington, and I will be taking you through our recap today. Um, so first, just a reminder that we do have a specialist session again today available for our local partners only with our famous Doug Franke. Today he'll be answering those burning compliance and audit questions. So this will begin after this presentation. And again, this is a USAID free zone and only for our local partners. So please log in and join Doug after this session. Just a few things going back and recapping some of the functions of our website. So if you were not able to join us yesterday, or maybe there was a session that you missed, you can go back and watch the recordings. The recordings for yesterday's sessions are up on the on-air platform. If you start from your USAID virtual attendee portal or kind of that login page and click on yesterday on the schedule tab, it'll take you back to the sessions from yesterday. You can scroll to the session that you're interested in and click view, and then it'll take you to this screen. And on the right-hand side, you'll see a tab where it says session recording, and just click the play button and it should bring up a video and start playing. You can also look at the session information tab to find information about the speakers that were also presenting during that session. There's also these functions, if we go back to the USAID virtual attendee portal, on the right for connecting with delegates and looking at the poster and program gallery. So we, again, encourage you to use these functions as well. A number of partners have put posters there talking about their work. So we encourage everyone to go check that out. There's also some more information from ASAP and USAID about programs and functionality of the website in case you need a refresher. Also, again, there's the Connect with Delegates tab, and we really want everyone to use that tab. So if you click on View, it'll take you to this page where you can go and engage with other delegates, scroll through the attendees, get some information, identify people that you want to connect with, and reach out to them. And we're encouraging everybody to do that. Try that today or tomorrow. But we really want everyone to try to reach out to somebody or multiple people that they would be interested in connecting with. Okay, and as always, if you're having some problems connecting or with the platform, please email FPD using this email address, and they will help address your problem. So with that, I want to go into the takeaways from our sessions today. So we had 10 sessions today with about an average of 100 people attending each session, give or take, so it's great. I'm so happy to see that everybody is joining in. We'll do recaps and some takeaways from 6 of our sessions, the first 6 sessions, and then we'll address the other 4 that we just wrapped up sometime tomorrow. So some takeaways from our first session, subaward management. This is where we were talking with a number of partners about how they manage subawards and they set up their systems. And what we learned is that pre-award assessments are critical to completing and ensuring that sub-partners have the necessary systems and capacity to implement awards according to USG standards. So not only are primes responsible for USG standards, but the primes are responsible for ensuring that the partners also are up to those standards. An electronic subaward management system can help you keep track of all requirements, including reaching targets, expenses, and monitoring visits, and can hold all of your supporting documents. So we encourage people to engage those. A collaborative rather than a policing relationship with a sub is really important to fostering capacity building efforts to help organizations improve and mature. Then finally, work plans and budgets often need adjustments, which is normal. So account for that and based on the realities on the ground. So don't be afraid if you have to adjust. Just keep USAID and your AOR aware of any adjustments. Moving on from our next session, reducing risk, a case study of setting up whistleblowers. A culture change on fraud includes continuous training, monitoring, and timely follow-up of systems used to report fraud. They talked about how employee engagement is the best source of fraud detection, and that whistleblower programs and retaliation protections foster personal responsibility at all levels of an organization. And fraud awareness is not just a compliance exercise. Also to note here, the Office of the Inspector General can provide regional and partner-specific trainings in fraud prevention. You can reach out, if you're a local partner and you want this kind of training, you can reach out to OIG directly, or if you don't have that contact, work with USAID and your AOR and they can connect you with OIG to get this training. Our third session, takeaways from our client-centered services, multi-month dispensing and DDD. Rapid scale-up of 6-month MMD and DDD is crucial during COVID times, both for pediatric and adult patients. Need multiple options to fit different patient preferences. So no one size fits all when trying to implement these kinds of programs. It is important to engage directly with patients to determine the best course of treatment for them. And finally, family-centered approaches are essential in aligning MMD pickups, especially for children and caregivers. This just ensures that you can provide the best care possible for all patients. Moving on to our dreams session. So mobile and community-based services were scaled in response to COVID, but need to remain a viable option for delivering services for AGYW. So including, not just in COVID time, but, these mobile and community-based services are also essential and useful in non-COVID times. Economic vulnerability increased during COVID. So programs need to respond with a strong economic strengthening intervention, including both at bridge to employment and entrepreneurship. AGYW choice and service delivery is essential and may prefer services delivered in safe spaces that are easily accessible. And then finally, the future is virtual. We know that many AGYW are connected via online platforms, yet many lack access. Efforts are needed to both further adapt for virtual delivery of certain interventions, as well as increase AGYW access to phones. Takeaways from our viral suppression session. Technology can help us to understand the stories behind the figures so that we can best track results along the cascade and improve health outcomes. A need to fully leverage mobile platforms to support people living with HIV in adhering and remaining in care, such as conveying the results of the VL test and embedding appropriate behavioral messages such as praise, encouragement, tips, and referral to services. The OVC program provides a valuable opportunity to successfully achieve viral load suppression through mitigating barriers to care and treatment and support for caregivers and families. And then lastly, opportunities such as local partners conference and participating in technical sessions emphasize the value of learning new approaches and innovations from partners across different aspects of the clinical cascade. Moving on to optimizing HRH staffing. So staffing is a cost driver of PEPFAR programs, representing over 22% of USA global expenditures. So we need to ensure HRH tracking and use of data to ensure optimized staffing for performance. A reminder of Q4 HRH CUR reporting and new HRH inventory to be required in FY21 Q4. Robust metrics are needed to allow for performance monitoring, program planning, staff placement, and MERV reporting. These systems enable rapid implementation of measures to safeguard health workers, including the use of mobile health services, flexible scheduling, provision of PPE, and mental health support to staff who test positive or were required to quarantine. Finally, partners used HRH data during COVID to ensure continuity of HIV services and implement interventions like home delivery of ART, the Elite 8 approach, or assigning high-risk health workers to telework and supporting TLD transitions. Okay, so with that, that ends our recap. So just a preview for tomorrow. We will be starting off with our welcome and orientations as we do every day. We'll then be moving into small discussion groups where we will be talking about some challenges faced during implementation of COP20. We'll then move to a solutions report out for our discussion groups. We'll then be joined by some of our USAID mission directors for mission director remarks. And then finally, our closing plenary journey of a USAID local partner, lessons from our oldest PEPFAR local partners. And then finally, again, closing remarks from the OHA front office, where we'll be joined again by Clint Kavanaugh. So thank you, everybody, for your attendance today and for joining. With that, we will close. And again, a reminder for our local partners only to join Doug Franke to answer your compliance questions. Thank you very much.